Hi, I'm Dr. Ric Procyshyn. I'm the principal editor of the Clinical Handbook of Psychotropic Drugs. I'm also a clinical professor in the Department of Psychiatry at the University of British Columbia. I'm also a principal investigator in the BC Mental Health and Addictions Research Institute. I've been asked as the principal editor of the Clinical Handbook of Psychotropic Drugs is how do we maintain the quality of the handbook? And let me give you a bit of a historical perspective. In 1989, the first edition of the handbook was released. It was about 60 pages in length. 33 years later, the handbook is now over 450 pages. The content of the handbook includes chapters that you would expect to find: antidepressants, antipsychotics, medications used to treat ADHD, and mood stabilizers. But we have other unique chapters as well. And one that I'd like to point out is unapproved treatments for psychiatric disorders. This is a chapter that reviews the literature, medications used to treat medical conditions, but they do have an effect on some psychiatric symptoms. Of course, this is reserved for patients that are resistant to conventional therapies. We also have charts that clinicians very much appreciate. They're easy to use and they're fast to use. I'll give you an example. We have the relative tolerability profiles of antipsychotic medications. This chart reviews and compares antipsychotic medications with regards to their high, their moderate, or their lower likelihood to cause an adverse event, such as sedation, extrapyramidal symptoms, or akathisia. One of our contributors, Andreas Baskis, also developed a table, Genotype Effects of Pharmacokinetic Properties of Psychotropic Medications. In this table, he lists the psychotropic medications that are affected by ultra-rapid metabolizers, intermediate metabolizers, as well as poor metabolizers. He also lists and explains potential consequences of these phenotypes and provides recommendations. So back to the question of how do we maintain and ensure the quality of the information in the Clinical Handbook of Psychotropic Drugs? It starts with our contributors. So the contributors of the handbook are pharmacists, pharmacologists, and psychiatrists. The pharmacists, for most part, have advanced training and degrees. Many of them are board-certified psychiatric pharmacists. Many of them are involved in research. Our psychiatrists also have extensive experience in various areas of psychiatry, and many of them are also research scientists. A new version of the Clinical Handbook comes out every 2 years, and our work starts about a year and a half before the release. At that time, our contributors receive their previous edition, the previous chapter that they had updated from 2 years ago. And they do an exhaustive literature review to see what is relevant for the new edition of the handbook. And they add this new relevant information to their chapter. After that's done, they send their chapters to me. As the principal editor, I will edit their chapter. I will also do another literature review. And when I'm done, I send it to my other lead editors. And they will independently review the chapter. They will independently edit the chapter. And they may also do another literature review. Once the lead editors have agreed upon a given chapter, the chapter is then sent to our publisher, Hogrefe. You would think that that's where our work stops, but it doesn't, because we will receive the galleys back with queries. I will address the queries, and at that time, I will do another literature search to make sure that there isn't something that just came out in the literature that we want to capture in the Clinical Handbook of Psychotropic Drugs. The handbook is extensively referenced. If you possess a physical copy of the handbook, we only include pivotal references because we're limited by space. But if you have an electronic version of the Clinical Handbook of Psychotropic Drugs, then you will find all of the references included in that version. I'm very proud to be the principal editor of the Clinical Handbook of Psychotropic Drugs. And in fact, I use it every week as a consultant psychopharmacologist. And I often hear from clinicians and colleagues in psychiatry that use the handbook, that have the handbook, and they say how important it is for their practice. But more important than that is how it has improved patient care. Thank you.
My name is Kalyna Bezchlibnyk-Butler, and together with Dr. Joel Jeffries, I am one of the originators of the Clinical Handbook of Psychotropic Drugs. This handbook was first published in 1989, and its origins were a compilation of articles on psychotropic drugs written by pharmacy staff at the Clark Institute of Psychiatry in Toronto, Canada, now known as the Centre for Addiction and Mental Health. The articles were written for clinical staff to better understand the comparative pharmacological properties of psychotropic drugs, including their actions, adverse effects, and drug interactions. These articles were compiled and reworked into a handbook format. As our knowledge about psychiatric disorders and the role of psychotropic drugs changed over the years, the handbook was regularly updated, and new editors and co-editors with expertise in specific areas were added to the team. I am grateful that with the expertise and dedication of these practitioners, including the current primary editor, Ric Procyshyn, the Clinical Handbook of Psychotropic Drugs has continued to be current and an important and practical reference in the field of psychiatry.